Goodbye A cup, welcome C cup. We saw a lot of like Asian doctors, Asian patients.
Yeah.
So is there any particular difference in Asian women when you examination and estimation of the patients?
Yeah, so I've been coming to Korea and Asia a lot for the last 10 years. One thing I saw changed a lot in this time around. I have the impression that Korean women are going for larger sizes.
Yeah, I
a
think
little
too.
bit.
Yeah, I think that too.
Yeah, I must say, I know there is a pressure of the social media and everything for that, but I think women should not go so big. Especially with the small frame. I feel like too big breasts, they look beautiful now, but in 10 years they can stretch the skin, and I think a natural result is better. We have seen this in the world. In the 90s, the really big breasts in America, Pamela Anderson.
Yeah.
And then America is gone smaller. In the year 2000, in the UK, much bigger. Now it's going much smaller again. I think now Korea is going on the phase of going a little bit smaller, but I hope go a little bit bigger, but I hope goes smaller again. But Korean women, they usually have very good skin, which helps the skin strong. Caucasian skin is a little has less elasticity.
Oh, really?
Yeah.
So they have a lot of sagging.
They have much more sagging than Korean women.
Okay.
We do a lot more mastopexis in Europe than probably in Korea.
I think nowadays Korean women have a desire for bigger breasts right now. So last week I went to the ASPS meeting in Boston.
Yes.
And the trend is putting in a little bit more smaller implant and do more fat graft around the implant. So I think that trend will settle like in a few years in Korea as well, because there are a lot of people who have bigger size, but they have a lot of sagging, drooping. So a lot of mastopexy has to be carried on. So I think later on the trend will follow your trend in Europe as well.
Sure. I've been talking about hybrid breast augmentation at least for the last 7-8 years. Last year we had a paper published on PRS with Scott Spear.
Yeah.
About hybrid and actually how we should do this. It was published on ASJ, I'm sorry.
Oh yeah, ASJ.
And I think that's the future. A combination with fat. Sometimes I've heard this in Asia, that Asian women are afraid of the fat because they don't think they have a lot of fat. But you don't need a lot of fat. It's just a little bit of fat to bring the implants together, improve the cleavage. Yeah,
I also agree with that. I do a lot of hybrid augmentation with to the cleavage area, because that gives a little better curve between the two breasts.
Yes.
And make the breast distance closer.
That you should call Dr. Ryan's cleavage design.
No. Well, we have a lot of like our clinic is quite famous for narrow cleavage and natural curve.
That's the thing that every country in Asia, that's the first thing patients ask.
Yeah.
They always say, I don't want my implants far apart. I want a very narrow cleavage. That's the thing. All countries from Korea, Japan to Southeast Asia, Thailand, Vietnam, all the patients, they're most concerned about the cleavage. And fat helps a lot to give a better cleavage.
Yeah, I think fat is kind of like a blessing.
Yes.
For a lot of patients.
I call fat liquid gold.
Liquid gold, yeah, I think so too. It's very valuable.
Very valuable.
A lot of Korean women and a lot of Korean doctors are really obsessed to dual plane.
Okay.
So